Hello, everyone. My name is Michael Hartman. I am a licensed mental health counselor with a diagnostic credential in New York State. I'm also a certified DBT therapist. I run InsightDBT, which is a DBT private group practice in Limbrook, New York. Today, we're going to be going over optimal treatment in DBT. I want to give a big shout out and kudos to the source material for this training. Navy SEAL Kenny Bigby Jr., who spoke about the idea of optimal performance versus peak performance in training and combat. Now, this sounds a little funny coming from a therapist, but the idea of peak performance and optimal performance go into everything, whether you're a therapist, a stock trader, a farmer, a Navy SEAL. There's an old saying that the SEALs have that when the going gets tough, you sink to the level of your training. So training is very, very important. However, real life circumstances make techniques unavailable at the time. Where as a certified DBT therapist, I was trained across all the DBT skills and all the know-how. But when you have a real life client come in, and that's a chaotic situation, it's a situation that is not in your control, what they come in with, what they have the strengths to gain, what skills will come naturally. But, you also don't know what weaknesses they come in with, what barriers and resistances that are both within the client and within their environment. So we can harp on skills that are textbook examples of the way to a life worth living, a way to a more emotionally regulated state. But if it doesn't gel with the client, we have to rethink things. I'm going to get into all this soon. We're going to have a jam-packed training going over taking everything we have learned as DBT therapists and bringing it to the client's level and helping them build from where they're at. There's the old saying is true for all therapists. You have to meet a client where they're at. This training will also address treatment interfering behaviors, not only with the client, but within the therapist. We're all human. And when we all have that difficult client that comes in that is posing a challenge that's not necessarily so easy to solve, we end up sometimes coasting in sessions and taking a more passive stance when we could be getting active with them in a way that the client will be receptive to. So when I'm training my team, I always like to listen out for, are they giving it their all? Or is this a time where they're coasting? And I'll be giving this training to them in a few days during our Sunday training and our Sunday group consultation to go over this some more. So this is my first run with teaching it. And they say, through teaching, you learn. And I hope to discover insights with you as I process this material more and more. So now we're going to segue to the PowerPoint. Optimal treatment in DBT by me, Michael Hartman. You can see my practice's website below, as well as my email address if you'd like a free copy of this deck, or if you are a prospective client looking into getting into DBT in the Long Island area for in-person DBT, as well as remote for, in general New York State. All right, here we go. So, peak performance. Let's start off with that concept. Peak performance is when you train your skills. When you go to a DBT intensive training through Behavior Tech, PESI, some type of hometown grassroots training, kind of like what my practice does. These are trainings where you're training your skills. To use the Navy SEALs again, right? This is their combat routines, where they're learning how to fight, They're learning how to survive in their training post. They're learning how to get the skills down so that they're very proficient with their skills, so that when they get deployed, they can fight and they know what to do to fight. And the same thing's true with us as therapists. We go through grad school, sometimes master's level, sometimes doctoral. We're learning all these different ways to reach a client, all these different modalities of treatment. We're getting tests on them. We have to do process recordings of certain sessions for a supervisor to reflect on what we did. We're reading books, trainings, etc., etc. This is where peak performance comes from. You're learning how to be a therapist in ideal conditions, not in front of a client, but from a book, from a teacher, from some type of source of knowledge, and you're trying to replicate those skills within yourself. Optimal performance, on the other hand, is IRL, or in real life performance in sessions. When you have a real living, breathing person in front of you, where you basically have to give them the tools that you learned. But the thing is, as I just discussed, a person comes with all their trials and tribulations when they come into session. You might have somebody who is hyperly, emotionally dysregulated. Their emotions are hyper aroused, right? And they're going to have a hard time slowing down to do a breathing exercise. They might grasp maybe the psychoeducation on mindfulness, but it might be very hard for them to practice mindfulness in their everyday life. Remember, we're getting these people with all their life experiences, all their success with therapy in the past, and all their failures. That's also true for self-improvement. That's also the preconceived notions of what they can and cannot do. That's also the resistance to experiencing feelings, the avoidance patterns, everything. We get a real life breathing person in front of us. Now down here, there are two excellent points. So making clarity in the chaos of sessions. So you want to get to know a client through intake and through that rapport building period, really from the jump. You want to start asking yourself and start really sniffing out and using all of your assessment skill in you and all of your hunches. And you want to start to see the client's patterns. For example, right, you might have a client who's terribly, terribly anxious, and they're anxious about everything. And you want to start picking up on the triggers of this anxiety. You want to start picking up on the FIDO of it, frequency, intensity, duration, and onset of their symptoms. You want to really get a feel for what perpetuates this client's symptoms, what maintains them, what beliefs do they have about their symptoms, what's their attitude towards their symptoms. You want to really start to understand them because you really want to know a roadmap, a guide, a really good analysis of what your clients go through and what maintains all of it. It's very, very important. You want to know, you really want to do almost like an engineering analysis on their mind, on their history, and their symptoms, and see how it all mixes. They went through trauma, relationship trauma. Maybe they went through capital T traumas, being exposed to major dangers, extreme emotional trauma, sexual trauma, right? You want to know what keeps this person's symptom cycle active and what has really created this client in the form they are today, in the way their mind works. Because once you understand the mechanisms of their mind, you have clarity of what to work on. Once you understand the resistances that, are going to come because of their life experiences and their self-beliefs and everything, right? You're going to know what you have to tackle before that symptom starts to go down. Let's take a more higher risk example, like self-harm or suicidality. what is the chain analysis, to use a DBT term? What is the chain, the vulnerabilities within the client, the sequences of events that lead to a problem behavior? Because you really have to figure out those factors. Nobody's going to give up something that they were doing for a long time, and we can argue, yeah, okay, but it's not working for them. But here's the thing, everything has a purpose and a reason. So cutting might be causing major harm. Suicidality might be getting them into the hospital regularly and not allowing them to function well because they're being hospitalized a lot, and they're not being able to go to school. They're not being able to hold down a job. They're not able to handle the stress of life. But we got to understand, like, there's a function to that. Are they going to the hospital because, they really can't stand their home environment? Are they going to the hospital because their emotions are so dysregulated that they need a respite in some type of way? Have they given up in some ways, and so has some part of their mind, their emotion mind, does it have a belief I can't change, but they don't really want to die, and the hospital is kind of like a safety net that keeps them alive. We want to really make clarity in all the chaos and all the factors. We want to turn chaos into clarity. It's very important. And the same thing goes for the bottom. We want to find the emerging patterns in session. You give somebody some skills, they don't try it. You give somebody a diary card, they don't try it, or they don't do it, as frequently that would be able to, the skill or the tool to be useful, right? Like, what's the pattern of that? You give it to me and I forget. Does the client forget about everything? Does the client have a hard time with executive functioning? Or do they have major deficiencies in organizing themselves? Is there a resistance coming up that comes up every time we try to do a change-based process, that we try to apply an intervention to get the client somewhere, that some type of resistance emerges, willful or not? You have to make sense of these patterns. And this is what makes the difference between peak performance and optimal performance. And this is the joke in graduate school, where you see these masters of therapy. Take Marsha Linehan, for example. We're doing a little DBT, here. So, she has these videotapes of these clients in recorded sessions, right? And we see like, oh, wow, she's really applying everything. But here's the thing, that's not a real life client. And that's the joke in graduate school. Why do my sessions not look like the same thing on the video? Okay, maybe it's because, excuse me, I'm just grabbing a tissue. Maybe it's because you're still in graduate school and you're not a master therapist yet, yes, but also at the same time, it doesn't reflect a real session. It's peak performance. The client might be an actor or might be a real person, but they know they're going on camera. So they're going to be very agreeable. They're going to make sure they did their diary card for that, that week, because, they're going to be on videotape and they want to show that they were, they did things, right? It's not real. But these videos are kind of clean room tests of like, this is how you apply, let's say, using the diary card, or it could be a mindfulness tutorial with Steve Hayes, or what is it called? Cognitive diffusion tutorial with Steve Hayes. It could be a psychodynamic training, helping somebody realize defenses and whatnot. It's not, these videos are not, real life sessions. So when you go from, the expectation that like, I have these great tools, and then, you go into session and the client's not talking, the client's not responding to your handout, they have a glazed look over their eye. Like, that's where we go from going from peak performance, practicing in a clean room, practicing in a controlled environment, to actually a real life scenario where we have to be optimal. We have to optimize the situation. A client that glazes over when you bring out some psychoeducation, or you bring out a skill, or you try to talk to them about deeper matters, right? Like, you have to make the best of those situations. And we're gonna discuss how to do this with later slides. But that's the core difference. You're going from an ideal scenario of what you think therapy is in your head, and you're going down into the real world where, clients have struggles and resistances and aren't necessarily going to go along with things. What do we do there? This is also where it goes to, when you get thrown into the fire, when you get thrown into a real life situation, you sink to the level of your training. That Navy SEALs saying, you sink to the level of your training. So, that's why it's very important to still train in these clean situations, in these learning situations, because we have to be ready to disseminate that skill or process something in a skillful way or explain something in a skillful way when the client is ready. But, a real life situation is way, way, way different than learning. So let's keep moving forward. So optimal performance continued, doing the best with what you can, dealing with a real life client with strengths, weaknesses, resistances, and barriers. I've said quite a bit about that at this point, so we can keep on going. So let's take a case example, right? So we have a 20-year-old female client. This is not a real client in the practice. So just, so no one's identity is being, brought out in this training. So they have a trauma history. They have a marijuana dependency. They cannot focus well, probably because they have a trauma history and maybe they're smoking like throughout the day, vape, joints, and everything like that. Is having a very hard time with mindfulness and rejects the concept of breath work. The therapist started mindfulness training and started to talk with them about being mindful of the breath. And there was a negative reaction. It doesn't work for me. I don't get it. It's never worked for me. My past therapists have totally tried to do this. And she can maybe even say this client, in fact, it feels patronizing at this point, or, this makes me clam up even more because it's just something that doesn't work. So what do we give her? So mindfulness, if we're going to try to continue to instill mindfulness because we think it's important, do we recommend mindful walks, mindful eating, mindful music, mindful noticing of thoughts? If you get yourself a skills training book, there are so many examples, and in your own mindfulness training, it would be good for you to also have quite a few ideas of how to be mindful. Can we modify this so that the client can incorporate noticing their experiences, noticing before reacting? Can we soften it? Can we mold mindfulness into what this client can do instead of what we think they should do? Sometimes a client who says that they really have a hard time with breathing, you treat them for a year or maybe 2 years or 6 months or however long, and maybe they start to do better and mindful breathing clicks. That's great. But maybe there are some people who are like, I'm not really a breathing person. I like my mindful walks. We actually just had a training at the practice where we actually invited some therapists from the community to come and learn mindfulness with us. And one really bright therapist came, and she was awesome, and she said, as she was reflecting on her own stuff and frustrations that she wants to be more mindful of, she said her mindful break or mindful treat or mindful reset was going to find her favorite flavor of Dum Dum Lollipop, which she keeps in her room or somewhere in her house before getting everything, in the house ready, to end the day. Her children, her family, coming home from a long day of work. Instead of just going into that unprepared, right? She said, I'm going to try to really make a routine where I go and, I try to, find my favorite flavor of lollipop, and I'm going to go, I'm going to enjoy it for a few moments and keep it in my mouth as I then go down and start, getting everybody ready for dinner or bed or whatever have you. And she said that would ground her. You got to think creatively for your clients. Like what is the client's strength? What do they already do? And how can we incorporate mindfulness into that? How can we incorporate mindfulness into that? Whether it's while they're doing it, they're really mindful and observing and describing and participating, being in that act. that behavior, that activity? Can they be, using the favored behavior, art, music, anything, even I don't know, like polishing their fancy shoes, and can it be something that can be a grounding technique that they can do at the same time as, like, thinking about their day, and saying to themselves, like, how was I today, as they polish their shoes. That's something I like to do, so I'm just throwing that out there. Okay, so the next point is, do we throw out mindfulness and go psychoeducational? You as a therapist, might say, I think we need to talk about how trauma affected you. I think we need to, kind of touch on that. Does the client know, as we see below, cognitive issues around trauma, avoidance strategies, hyper emotional arousal, self concept issues, flashbacks? Like, what is this client dealing with? If they were to be mindful, would they face the full fire, the full force of a trauma flashback? That's really scary. I know if I was in that situation, I would try to numb out as much as possible, or at least that's what Emotion Mind would say. Emotion Mind's pretty strong when you've been through trauma. It's pretty empowered because it's so dysregulated. Are we trying to give mindfulness to somebody who needs to do a lot of maybe some mindful catches that they're getting dysregulated, perhaps dissociating, perhaps thinking they're a piece of crap because of everything that happened to them? And maybe can we do some distress tolerance techniques, at that point, not to be fully mindful, but a mindful catch, and then say, okay, I need to go use my tip skill. This is a time to go outside for fresh air. This is a time for me to go get a cold glass of water. This is a time for me to check in with my mom. This is a time for me to do something to proceed mindfully, thinking of the stop skill. It doesn't have to be mindfulness as in the full embrace of your, mind, but also just, can I do what needs to be done to be effective in this moment, to endure this moment as best as I can while I'm trying to get better. Psychoeducation could perhaps open up the door to that conversation. We have to go optimal. We can't follow any rigid sense of what DBT or therapy is. We have to meet the client where they're at and start to really be curious. What are the patterns emerging here? They try mindfulness, they can't do it, or they're not approaching mindfulness, in a way that they're, embracing the idea. What can I do next? How can I support the teaching of that mindfulness? Or maybe do I have to switch to something else? Is there another piece I can work on here? And that's the difference between peak performance and doing what's optimal in the situation, doing what's effective in the situation. That's another DBT concept right there. So, example continued. Do we just encourage self-care and lose the DBT framework right now? Not forever. Not that we're never going to get psychoeducational, or somebody does self-care and they do so mindfully, and then we bring that back up like, oh, we're having a hard time with mindfulness, but it sounds like you did that pretty mindfully, and exploring how well they did, and celebrating it with them, and reinforcing it with them, right? Like, and then going back to the DBT framework, and then pushing a little bit more, right? We have to pivot, and that, we have to sometimes drop our tools, and go for the most basic thing, and then work from there. It's about meeting the client where they're at and working with those resistances. They say no lock is unpickable. You see, you see heavy duty locks. Oh, I can't get through that. No, every situation is figure outable. Every situation has a resolution, but there might be a process and a sequence that has to happen before, you finally get through, before you finally figure out the main issue. And then the last point is, ask yourself, forget about how treatment is supposed to look. What can this client handle and absorb? What can they handle? What can they do? What can they have some modicum of success in? And what can they absorb? And so this goes to an important point of doing the best that, a client doing the best that they can. It's not a race against anybody else to get better. It's not to be as functional as my other family members or my siblings. It's not even a race against my old self anymore. It's a race against me as I am right now. And can I try to do 1% better this week? Maybe I could do 5% better this week. Maybe I can do a little bit more than I was today. It's not to change everything in an instant, but to figure out what can be handled and what can be absorbed. And that's a very collaborative process with your client. You as the professional making clarity out of the chaos, out of everything that's happening, out of everything that's going wrong, and figuring out with the client, what can we do that can go right? What can we do to be a little bit better this week at taking care of ourselves? How can we be a little bit gentler this week? This brings up a client um, that I had a long time ago. And they had a very, very aversive childhood and a lot of issues with family and especially their parents. And they said to me at one point after a lot of hard times, and setbacks in life that made them feel very depressed. They said, I never had the encouragement or love from my folks. And, this came up because I was like, self-care, self-love, you matter, right? That was like kind of the focus of the session. And then the client said, yeah, but I was never taught how to do that. So I don't really get it. And so, the idea is it's like sprouting from the rock bottom of self love and self preservation. We're growing something from the foundation. We don't have a lot of roots or a lot of ground to build on. We have to start small. And that was, getting a breath of fresh air, some techniques to visualize, if they were their own loving parent, what would they say to themselves? Things like this. And there was resistance there too, but we worked with it. And that client in their course of treatment, started to, incorporate healthier foods into their diet, started to get fresh air, really tried to push themselves to not sit in bed all the time because they were sleeping all the time. We called it time traveling, just to get through the day, go to sleep, you time travel through it, and we ended up working together, and the client figured out that, like, I think I could, maybe get up a little bit more. I could get out of bed a little bit more. If I don't feel like getting out of bed, can I sit upright and with my back up against, he didn't even have a bedpost, but against the wall, which my mattress is against. And can I try that for a little bit on days that in moments, maybe not full days, but in moments where I need to just get up, so what can they handle? What can they absorb? What's the optimal path forward for the client? And try to catch any self-judgments. It's not enough. Who are you to say that? If they build themselves up 1%, a little bit more, who are we to say what's enough and what's not? So we're going to do an exercise together. So you can pause the video and grab a piece of pencil and paper or something to write on. And I want you to pick a client and figure out, one, what are their strengths, weaknesses, barriers, and resistances. And I want you to pick that apart with a client. You can pause the video. And when you're unpaused, the next question is, have I been working with them from where they are at? Ask yourself, like, have I been in the trenches with them as to where they're at? They're not doing well with mindfulness, but they have a trauma history. We're tackling that and trying to do distress tolerance when they're getting hyper emotional arousal, hyper dysregulation, red zone moments. Are we learning about, for a client that is really struggling with interpersonal relationships, and we've given them the interpersonal effectiveness skills we've tried, and now there's a lack of not insight, but like the person's been ground down so much that they feel so scared to push themselves to assert their, self, their self-respect. They're so in give, let's say, that they're so overly accommodating. To use a metaphor, their spine is like jelly. They let people walk all over them. Has that been explored? Like, why do you think this is going on? How come? That's a softer way to put it. I was told, try not to use a lot of whys in your training. How come? Where did this self-belief come from? Is there an attachment challenge here where, the client has a anxious attachment style, or even deeper than just the basic four, right? Has pain and, heartache in relationships, combined with love. And where did they learn that from the first time? Explore it. Therapy does not have to go super fast. When you hit a resistance barrier, you know, talk about it, identify it, work on it, pick at it. If it doesn't respond to the picking, try to analyze it with the client. What's going on with you? What's happening here? You know, I feel like we're hitting a bit of a brick wall. Do you feel that too? Yeah, because I've tried assertiveness training before, and it was really hard, and it hurt. Maybe avoidance strategies are starting to kick in. You got to keep peeling back the onion. And the question is, right, have you been meeting them where they're at? Or are you kind of, checking out in sessions a little bit? Because it's hard work to really be 100 with your clients all the time, because the fatigue of helping them understand, and why can't you get it, right? Like, we have to really check in with ourselves. I have a lot of supervisees who really don't like cases, and I can understand where they're coming from with this. They really don't like cases that, like, it feels like therapy light. It feels like pseudotherapy. One of my supervisees said in the past, like, it feels like I have a non-client client. Well, what's going on there? What's going on there? There's such a thing as supportive therapy. And at the same time, are we going to help our clients help themselves get through the misery and suffering in their life if we don't keep on thinking about these things? It's food for thought. So, if so, what am I doing? What's your plan with them? So they have a trauma history. We have to address it. And as we're doing the trauma history, I'm giving them distress tolerance techniques and maybe a bit of emotion regulation techniques. I'm if they're okay with it, if they can handle it, maybe we are doing some check the facts and opposite action. Maybe there's a lot of avoidance there, so maybe opposite action is very, very hard for the client. It just really gets them going too much that they get overwhelmed. The question is, it's like, what's the plan? What's the plan B? Okay, we talked about the trauma. They're doing distress tolerance, right? Like, we're processing the trauma, and we're working on that. And now we're talking about values, and going through the client's values and helping their behavior match. Let's say the client with this trauma history, that 20-year-old, you're 6 months ahead in treatment now, and things are getting better, and they want to tap into their values of being industrious and maybe supporting themselves. So the idea is, like, I want to use the degree that I have. That, let's say this client, or they're 20, so they probably don't have a degree yet, but let's say they want to start to get a job. And then, like, there's a breakdown there because facing that anxiety around getting their first job, they have maybe a core belief, like, or a myth, as we would call it in DBT, like, they might not want me. Nobody's going to want me because I don't have a job history at 20, so working with that, you really want to see and really work out in your mind the treatment plan. Like, okay, I want to get them here. I want to get them towards a life worth living. I want to get them regulated again. I want to get them doing better, right? But what are the stepping stones? And if you've been doing it, great. List out what the plan is. If not, What preconceived notion is holding you back? Check in with yourself. Do a little bit of soul searching, maybe in your own therapy, maybe with yourself, maybe with a supervisor, maybe with a colleague or a friend, and discuss it. Um, figure out what needs to change in the way you're approaching the situation for you to help the client be where they're at, or to meet the client where they're at. After this, you want to create a new plan to work with the client and ask yourself, what can they tackle? And how are you going to look out for an opening to expand? The idea is we're trying to help the clients find more of themselves. And yes, we do have to do what's optimal. They're not ready for more yet. Okay, let's talk with them about that. Let's figure out what the barriers are, the resistances is, the history. Okay, and now after that, we're going to try to add 1% of self-care to that, 1% of distress tolerance, 1% of interpersonal effectiveness, 1% of mindfulness, and see how it helps them expand. We are balancing a dialectic, meeting the client where they're at, and at the same time helping them find more of themselves. It's like one of the core DBT group assumptions. We're doing our best and we have to do better. And so, that in itself, thinking about it now out loud, right? Like, if a client is doing their best and they're smoking a ton of pot and they're avoiding anything that's really emotionally activating, right? That's the best that they can. And maybe the better is exploring what is sustaining all these behaviors, poking the past with a little stick, to say, hey, what's going on here? And trying to examine it as best as they can. That is them doing better. Looking at their problems and being brave and examining their thoughts, feelings, and experiences, that's them doing better, because that's the next step that makes the skills acquisition possible after the whys are figured out, the how comes. That's very, very important. Very, very important. So I think we're out of slides here. So I'm going to transition over to here. I hope this training has been very helpful for you in learning this concept of optimal performance with actual clients. You want to stay curious. You want to stay hungry to help your client no matter where they're at. If you feel like you're getting overwhelmed by a case that isn't moving anywhere, it's important to talk about it. It's important to get help yourself. Clients are not the only ones who interfere with treatment. Depending on where we stand, depending on where that is, if we've given up on somebody and we're not trying so hard anymore, that makes the world a difference. I believe, and this is a DBT thing, also a personal thing, like the therapist is an active participant in the therapy. We're giving tools, we're asking questions, we're passing down our knowledge of psychology, our knowledge of how things affect a person's mind, how experiences inform behavior, inform cognition, everything. We're passing that down to our clients. And so if you're getting stuck, it's very important not to be isolated. So if you have a treatment team that you work with and you are stuck, this is hopefully maybe a wake-up call to raise your hand in a group meeting or a team meeting, or to knock on a colleague's door and ask them if they have a client and try to chew on things. This is the time maybe to talk with your own personal therapist or your supervisor. We do a little quasi-therapy, a little bit, because we want to help you be the best that you can at work. And if there are things going on with you in your mind, in your belief system, in your fatigue, this is a hard job. We have a lot of us have big caseloads. A lot of us are balancing personal lives. And, they're like, I can't deal with this anymore. Or maybe it's even the paperwork of the job and not stressing it, whatever. The whole point of it is you need support to do this right. We're social creatures, and just like our clients, we really need each other to be able to help ourselves reflect and process and understand if we are engaging, in non-optimal performance because we've given up on the client because it doesn't look like the textbook, or this is too hard, I can't deal with them. The question is for you to look within and say, what's going on? So that's my last little lick of something to give during this training. I hope you found it helpful. If you'd like a copy of the deck or have any questions, you can reach out to me at michael@insightdbt.com. And it was a pleasure talking to you today. I hope the rest of your day goes well. Thank you for joining me. Be well.